Good morning, soon to be good afternoon for everyone getting on the call right now. We'll just give it one more minute and then we'll get started. This is almost lunchtime for some of us, so feel free to grab some food as you participate today. We're excited to have you. If we were in person, we'd feed you, I think, but not today. Okay, as people continue to trickle in, I'm going to introduce myself and then I'm going to turn it over to our moderator for this discussion today. My name is Dr. Rick Hall. I'm a clinical professor at Arizona State University and the Senior Director for Health Innovation. This is our third annual Hacking the Human Conference. Every year we have a new theme. This year's theme is on technology's impact on human connection, loneliness, and health. And when we thought of this idea, it was relevant, and over the course of this past year, this theme became even more and more relevant. And so one of the topics that became to the front of our minds was the role of technology and social media and screen time on health. And so we assembled today's panel to just share their stories about what these topics mean to them, what their background is as relates to these topics, and then would in just a very informal conversational tone. As panelists, they'll be asked some questions by their moderator, and at the very end, we'll give you all the opportunity to ask questions. So those of you who are in the participant element of Zoom, feel free to use the chat box throughout this presentation or this conversation today. And we'll get to those questions toward the end, but feel free to use that chat box at any time as you think of questions, and we'll try to get to as many of those as possible. Also, I want to invite you, this is our third general session, but we've had, this is actually our fourth total session today, and we have one more after this. So I want to invite you to also come to the tools and solutions for managing connection, and those will be that link will provide that Zoom link at the end of the session for you to come back. So we'll give you a 10 or 15 minute break, and then our last session will end at 2 o'clock today. And finally, if you hang out to the end of the session, we're going to give some door prizes away to some of our participants. So I want to encourage you to hang on to the very end, and at the very end when we come back and invite you to that final session, we will also give away 3 door prizes. So without further ado, I want to introduce one of our student leaders at Arizona State University, and she happens to be also the entrepreneurship catalyst for the downtown campus, as well as one of the student leaders for the Health Entrepreneur Accelerator Lab. And she's going to be our moderator today. She also was there when we planned this entire conference at our HEALab advisory board meeting about a year ago. And so she was elemental in helping frame the topics and the subjects from a student perspective. So we're very excited to welcome our moderator, and I will turn it over to her, and she will introduce the rest of the panelists. Dana Rasmussen. Thank you, Dana.
Thanks, Rick. I appreciate that. Yeah, and I love this topic. It, like you said, was relevant many months ago, and it's even more relevant now. So I'm super excited to have the panelists with me today. We have Chris Wharton, the Assistant Dean of Innovation and Strategic Initiatives and Associate Professor of Nutrition here at ASU. We have Jim Whitfill, the Senior Vice President and Chief Transformation Officer at HonorHealth. And we have Jasmine Bhatti, co-founder and CEO of Navi Concierge Nurses, as well as Ayan said, the other co-founder of Navi Concierge Nurses. So we're gonna jump right into it to give you guys as much time for questions at the end as possible. So I'll not read their very accomplished bios. But this first question, I'm gonna hand it off to Chris and kick us off with, how has social media and technology affected our personal well-being?
Thanks. It's a pleasure to take part in this discussion today. So I do a bit of research in screen use generally, and so a bit related to social media, but more in terms of our interaction with screens. And it's been a growing area of research because, of course, screen use in our lives has been growing wildly for now decades. And I mean, today we really don't really know what our lives and lifestyles look like without a complete inundation of screens. I mean, for almost all of us across a socio-demographic spectrum. And so it's important then to understand, I think, whether and how screens can be used to be more efficient, more productive, happier, or how they might affect us in terms of health and happiness in negative ways. And so we have published a couple papers recently just focused on screens and screen use across devices, because these days it's not just about, a lot of screen-based research, screen use research is really focused on TVs, but of course we spend our times in front of TVs, but also in front of computers, as we are doing right now, or in front of smartphones and other types of devices, tablets and the like. And so we really wanted to understand how these different types of devices might be associated with health and health outcomes. And just speaking from my research and what we found and published on is that different types of screens affect our health and well-being in different types of ways. And so it's the case that heavy use of screens has generally been associated, and we've shown this too, with negative health outcomes. That's not to say that screen use is a bad thing, right? It's how we use screens. And so heavy use of TVs, we know, is associated with sedentary time, which itself is then associated with poor health outcomes. We know that use of smartphones, our recent study showed this, is associated with poor sleep quality, which can be problematic in terms of obesity and other sorts of things. But we also showed actually that laptop and computer use, heavy use of those things, wasn't really a problem. And that might be because people use those more often for reasons of productivity, doing work and school and things like that. So really it becomes much more contextual. How are we using screens? What is the pattern of screen use? And then that's where we can get to what's its actual impact on particular health outcomes and health behaviors.
Well said, Chris. Does anyone else want to add anything to that? Of course, we can always jump into the solutions as well.
This is Jim. I mean, I think, Chris, it's interesting you talk about the sleep component, and I think later on I'll talk a little bit about my own experience. Medical training in general is not really good for sleep. Graduate school, I know, is also not good for sleep. And then you kind of go through these different phases. But I found several years ago that my smart device was really interfering. And I think, maybe Dana, a little bit later, we'll talk about our own personal experience. And I think sleep has become something that's been really critical. And ironically, I've used screen time tools to help manage my sleep, but I'll talk more about that later.
Yeah, absolutely. So yeah, I definitely, there's obviously a lot of struggle or challenges that we do face with technology, with social media. But of course, it is a tool and there are some benefits to it. So I do want to hand off a question to Jasmine. Tell me more about how you've been able to leverage social media or technology in a positive way as a nurse during COVID or before COVID even.
Perfect. Thank you again so much for having me here today. It's a pleasure. I think this has just been an incredible experience for nurses and healthcare providers in general to really leverage social media and use it as a platform. I think we're seeing a few things in social media. There's a lot of misinformation and disinformation that's being spread, and as healthcare providers, it's definitely part of our responsibility to help educate our communities about health concerns, particularly those related to COVID right now. And I also think it's a time where nurses and other healthcare providers have been able to actually use the power of storytelling and really share pictures and share their stories of what they're experiencing to really help open the eyes of people who aren't really seeing what we're seeing on a daily basis and trying to make what we're seeing very real. So I think that's been great. And just speaking from personal experience, earlier this year in May, I went to a rally with a few of my colleagues, and it was actually a point in the time when we were trying to open back the state. And we just went to the rally and stood in front of the state capitol just to help stand as the voice of the people that we serve. And our stories that we put out into social media ended up traveling around the whole world. And I woke up the next morning to messages from people, and it was amazing. And we were able to use that platform for good and actually raise a lot of money for the Navajo Nation. We raised almost $300,000 from a platform just based on stories. So it can be really powerful if we use it in the right ways.
Yeah, absolutely. And even beyond, leveraging as far as like funding and beyond that, even like connections and social connections. And Ayan, I would love to hear your take and how you, if you have any examples or the way you've been able to tap into that power of social media to, get those connections.
Yeah, of course. I heard a quote recently to spark a fire, you need to gather kindling. And earlier this summer, there were a lot of protests happening downtown for Black Lives Matters. And I was really inspired by Jasmine to put together a protest of my own. I wanted to gather other healthcare professionals in support of this movement because it's really near and dear to my heart. I'm a Black immigrant. I've faced racism my entire life, and that coupled with my profession and duty as a registered nurse working on the front line, caring for people, I have kind of a unique understanding. There's an inequity in healthcare, and racism it's a public health issue, and there's inherent bias in medicine. I've seen this in my profession, and I've experienced it as a Black female patient as well. So with the help of my fellow nurse colleagues and friends, we collaborated and brought together a really huge group of healthcare professionals across the Valley to raise our voices and support a movement that we truly stood behind. And, this was really awesome because we were able to connect people and build this community. And we did this through the power of social media, because we had a connection and purpose and a why that was really truly meaningful. And this leads to a really powerful blazing movement, and that's what happened at the protest.
That's incredible. Yeah, absolutely. And I know you, Ayan, and Jasmine are both business owners, and I'm curious, what is your greatest motivator in social media, whether it's related to COVID or not? You're using it.
Kind of kicking that off, I think my greatest motivator is that I care. Like, I really care about our community. I really care about the people we're serving, and I care about my colleagues every day at work, like who are just a little overwhelmed with what's happening. And I think raising our voices in a way on social media that is impactful and enlightening, but just really truthful. Hopefully that's what helps make a difference. If I can help the health of my community, then that means the world to me.
Just to kind of piggyback off of that, that's a really good question, Dana. My primary motivator as a nurse and a business owner of Navi is what we're trying to do is really impact and empower people at scale. To us, Navi is really not a business. It is, but we're not just providing nursing services to people. It's a movement built on compassion. And that's exactly why I jumped at the chance to join Jasmine when she started Navi. We share the same desire to help create a deep change within healthcare. Excuse me, sorry. Some of the content that we've done includes interviewing patients and nurses and sharing really impactful stories of trials and tribulations. And we're working on a podcast. We're making videos, sharing social content to really expand our reach, and just building that community through storytelling. As nurses and business owners, we're here to educate and empower people our nurse colleagues and patients and loved ones alike, and to truly just create a positive impact in our communities, and social media is really allowing us to do that.
We are so lucky to have you guys a part of our community, and so thankful for that. I know, Jim, I saw you unmute a moment ago. Did you want to add anything to that?
No, I just think it's really powerful. I mean, social media, we've certainly seen a dark side of it this year. We've been, not just this year, but I mean, to me, the most exciting thing is you know, especially for people of color, for women, for people that are inherently disadvantaged by a lot of our hierarchical systems. Social media creates a space where you can find people who are like you, who have the same perception, have the same outlook. And that is so powerful, because one of the things, I mean, it's one thing to struggle you know, against some of these inherent privileges that exist that people like myself enjoy. But the sense of loneliness when you encounter those is even more overwhelming. So the fact that you can find other people who are facing the same thing, and you can link up together and share stories and build that camaraderie, I think it's such a powerful tool. And it's really the key of how we're going to be able to unlock some of the really difficult spots that we're in right now. So I think that I actually have a lot of hope for how we can use social media to improve things.
Absolutely. I think that's a great segue into kind of talking more about the opportunities that are out there. So beyond just solutions, you know, like, for example, how can young professionals use social media to advance their career? Or, you know, how have you guys used it to advance your career?
I might just mention that it's such a relevant topic right now in the world of academia. You know, we're talking a little bit about we have public health and population health degrees in my college, and training professionals to go out there and be involved in public health initiatives, be professionals in the field in all sorts of different ways. There are limits to that if one thing that they're facing is the institutions, the politics and everything else that may provide a whole different perception of the world or a whole different set of messaging. And so social media becomes because that's such a key way people understand information and create narratives out of it, you have to build into a public health program where before it might have been about what are the programs that help people maintain healthy lives or gain access to healthcare. Now it's also, what is political economy? What are the social institutions that make it either facilitate or make it difficult to get your messages across? And so now we have to build those things into our program so people can become savvy at telling a story. And the difficulty, of course, of it is that if you're wanting to just throw a story out there to persuade people and you're not worried about the evidence base, well, you can pretty much say what you want without limit because you're not constrained by that. But we have to be savvy as scientists and public health professionals, if we're trying to get information out, to be able to weave actual evidence and make sure that what we're saying we believe to be true, and then build that into a narrative that's still compelling. And so there's a whole new world of how to get our messaging out in a compelling way that actually resonate with people. So we're trying to do that in our degree programs now.
Dana, I just wanted to add, I mean, I've definitely watched a number of my colleagues, particularly maybe in grad school or postgraduate, be able to establish a brand for themselves in social media. And you have to be careful, right, about you have to choose what brand do you want to create. And there's a whole art to that. But nonetheless, particularly in the professions, and especially if you're taking different segments, say if you're doing informatics and healthcare, or you're doing public health and healthcare, social media really allows you to establish yourself as an expert in that place. You can begin to appropriately kind of put out not only the evidence that you're finding from other publications, but then your thoughts about that. So it's one thing just to sort of parrot, here's a great paper, but here's a great paper that interests me because I was really struck by the research methods, or I was really struck by how they use different populations to really see whatever it is. And so because there's more and more people sort of dialing into these niches in social media, it's a way, I think, to distinguish yourself sort of in not just a national, but an international space. And it's been impressive to watch people carry that out.
I would agree with that too, and especially for students who are in the audience, like learning how to brand yourself and how you want to create your niche. That's just so important. And just being mindful as well as you grow in the profession of whatever you're choosing, just, being careful about how you're representing yourself and mindful of that. So I think for students, that's probably one of the biggest things I would just be cautious of.
Yeah, that's great advice. Well said, all of you.
I might just, sorry if I could add one more thing. It's just I'm realizing as we're having this conversation that I'm a researcher. I teach and do research, and the research that I've done the past few years, I'm realizing all of the studies that I put out, we've either also put out infographics along with that, or actually in one case I did a podcast series on it. And so I'm realizing that actually social media has become like vital to getting the information out. And I think it's actually kind of like the height of academic elitism to just like publish your paper and then be done with it. I think we really need to make sure our stuff is use inspired and actually gets out to be potentially useful to people in the real world. And so, yeah, I'm going to my marketing and communications people when we publish a paper. I'm like, how can we put an infographic together so I can throw that in Instagram? And then can I get this on iTunes so that people can listen to, we did a podcast, a five episode podcast on food waste, which I know sounds like the height of boredom, but actually it's really intriguing when you package it in this new format rather than just trying to read through a paper. So yeah, it actually is really important to try to get information out in a scalable way.
I definitely would echo that. It's way easier and kind of more fun and engaging to kind of, look through social media and, see infographics, and it's just a different way to kind of digest the information. And Jasmine and I know you guys were talking more about like, kind of that responsibility to present the right stuff, the correct evidence and the correct information, and being able to do that in a way that is digestible to a wide range of people is so, so important. Yeah, I'm curious too if you guys have used social media or even just technology, it doesn't have to be social media, in ways just to support your wellness, and how have you done that?
I can start this one off if you'd like. So one of the first things I realized in the very beginning of everything was that with COVID in particular, there was so much information all the time coming through, and we needed to find like quick and easy ways to communicate what was happening. So for nurses, for example, in Arizona here, we were hit later than in New York. So it was really important for us to learn what nurses were doing in New York first, just to like speed up that communication of, hey, what are you doing? What's working for you? And so I actually created a Facebook page for healthcare providers that not only was it a place where we could exchange ideas, but it was also a safe place for us to come and talk about our concerns, like how are you managing your family at home? Are you comfortable going home and sleeping in your bed? And what things are you struggling with? And it became a group where people just connected with all of their experiences and talking about it. And it was a great place to see, a safety. And it was just, people felt comfortable talking about things that they weren't necessarily able to talk with family. Like, for example, I don't want to go home and talk to my parents about what's happening because I don't want to frighten them. But talking to other people in this small space who understand what I'm going through, it's kind of like a social support group for what's happening. And so I think we've seen that on social media as being a way that we can use resources. And I know the Nursing Association here, they were great at actually sending text messages out. So you would just subscribe to something, and every week they would send out a text message about resilience and mindfulness and how to take care of yourself. So that's been really powerful for us to utilize.
Yeah, I wanted to maybe Jasmine to kind of build on that, and at the risk of sharing a little bit too much information. I don't normally do a great job of taking care of myself. I just sort of push through like whatever difficulties I'm facing, and I just try harder and sleep less. And that doesn't, I can tell you, that doesn't work long term. And increasingly, Chris was talking about sort of the problem of screen time on mobile devices and sleep. And I found that, as I was looking at the literature more and more, it's concerning when when you drive yourself without enough sleep on a regular basis. And the evidence is pretty good now that it correlates with a number of health problems. And so part of it was using technology to remind myself at every day, I feel so old when I say this, at 9 o'clock or 9:30, I have to have a little thing that comes up on my phone and says, you need to start winding down. And sure, for the first month, I ignored it. But then after a while, I said, okay, I need to pay attention to this, right? And I need to get regular amounts of sleep. And likewise for exercise, and even sort of whether it's meditation or mindfulness. And it's sad that I've had to, I wish I was the kind of person that had the discipline that I could just naturally do those things, but I don't. I'll kind of work forever or just stay up doing non-helpful things. So I think technology has a role for helping us sort of, at least for me, stay within the guardrails, of if I get this amount of sleep and I eat this certain way and I do this kind of exercise, then shocking. I mean, this is crazy. I feel better and I think clearer and I'm able to do more things. So I think it's an example of where it's not social media so much, but technology, can be a tool to really help us maybe do the things that naturally don't come easy, at least for some of us.
Absolutely. Yeah. It's sort of goes to that thing of, using technology, don't let it use you. And that's awesome. I appreciate you guys' authenticity and describing your experiences. It's very helpful. I'm sure a lot of people can relate.
There's a really good question. Sorry if I could jump in. It's talking about how do we advocate for mental health and self-care, especially in different communities. I'm a Somali immigrant. I was born in Somalia, but I grew up in America, so I'm kind of a weirdo. I really don't fit into either culture really well. But in Somalia, emotion is often repressed in my culture. I think the biggest way to tackle traditional views of identity and culture is to really be vulnerable. A lot of social media can be incredibly draining. Well, for me personally, there's a lot of like toxic positivity. And the way that I combat this is to take a page from Brene Brown and really be vulnerable online and not only sharing the good, but also the bad and everything in between. And I think that's been incredibly helpful for me. Yeah.
Well said.
I'll chime in too. I think building off all these things that folks have said, I think it's for those of us who have the opportunity, because not all of us do, obviously in the age of COVID, many of us have been impacted like really in severe ways. But for those of us who do have the opportunity to make some choices about these sorts of things, this is actually, it's, counter to what I've seen online, stories and things about, what are the top 10 Netflix shows you could be watching right now with your extra flexible time at home since you're, in lockdown or whatever. Counter to that, actually, this is a time where we could have some online social media screen time hygiene going on and actually figure out what are the tools and things that will serve my wellness the best. And then let me just get rid of everything else. And so, offering some personal details as well. So like a few years ago, actually a number of years ago, we got rid of all TVs in my house because we just decided, we'll watch shows and things on the computer here and there, but otherwise they're just kind of all gone. But that doesn't mean, I'm not still consuming a lot of screen time, but now I can be a little bit more purposeful. So rather than the default of a screen, in the middle of my living room, and that seeming to be the thing around which I organize my entire life, that's gone. And then I can begin to decide a little bit more about when I'm using screens. And so right now, while I'm home for the most part, I use screens for my own well-being. Like we downloaded the Peloton app a few months ago, and we're using that to work out at home since we can't go to gyms. And actually, it's cheaper than a gym, so you don't need any equipment, so it works out pretty well. But otherwise, aside from using screens in that way and for work and things, I actually can step back. And I think this is just something for folks to think about: is if you do have the opportunity to make choices, and if you do have some flexibility, and if you do have more flexible time in your day because you may be locked down or working from home, what are the things away from the screens that we could be doing? It's actually a chance, rather than to watch more shows, to step away and be like, well, maybe I don't want to scroll social media for however many hours I normally do a day. Maybe I'll return to a hobby I once was engaged in, or get back to just walking on a nightly basis, or do other things that are actually non-screen based. And I think because our lives are generally inundated with screens in most of the modes of things that we do throughout the day, we usually think, oh, what else can I do via a screen with my time? But instead we can step away and say, what could I do if I put all my screens away? And it's just for some of us an opportunity to think along those lines.
Thanks, Chris. Yeah, that's a great little trick that I might have to try for sure. But yeah, so I'm going to go ahead and shift the conversation to some of the questions from our guests today. So we have one question from Deanna. Assuming access to technology is a barrier we can address, in what ways can you imagine technology serving as an equalizer of disparity in clinical and SDOH care, particularly of our most vulnerable populations? I don't know if Jasmine or Ayan wants to jump on that one, but anyone is welcome to respond.
Just thinking back to the question a little bit here, and I was really amazed at what they did actually in Mexico when I heard about how they were trying to educate children. And it goes back to screen time, but obviously not everyone has smartphones there, and they were trying to figure out how do you educate people, and they were able to actually provide education over the television. Not that that's the greatest thing in the world either, but it's really hard, I think, when you're looking at social determinants of health and people that don't have access to these resources, how to go about managing them. And I think for us as healthcare providers, that really is a call for us to think creatively and meet them where they're at. So it's really kind of going back to what Chris was saying earlier of just how do we rethink things without technology, and rethinking them in different ways. So we know that there's cultural differences, and how do we blend those to make a service or a product, whatever it is, that's actually tailored for people, that they're receptive and they're willing to use it.
Well said, Jasmine. Well said. We have another question from Margie, and this one's directed at Dr. Whitfield. How has social media influenced our ability or our inability to manage the public perception of risks and engagement in the right behaviors during the pandemic?
Well, thanks, Margie, for that very easy softball question. Earlier about how social media allows people to kind of find a community of like-minded individuals. And I think there's a power to that, particularly if maybe you're disadvantaged compared to other power structures that exist sort of in other parts of society. But it's also allowed people to develop, and I'm going to try to be really careful here. I don't want to offend anybody, but there is allowed people to develop alternative narratives that are not based in any kind of published mainline science about this disease. And so I think that I think a lot of, I'm not a historian, but if I recall from the few history classes I took, there was a time in the late 19th century when the American printed press, the newspapers and whatnot, really began to propagate, and there was all kinds of different quote authoritative opinions coming out, and all of a sudden you could find muckraking, and you could find newspapers that would pretty much say whatever somebody wanted to say, right? And it became very destabilizing, right? Because something that you thought of as authoritative, i.e. it's in print, now anything could be like that. And I feel like we're in a similar time today where we don't yet know as a globe, as a country, as a state, as a community, we don't yet really know how to regulate that area, or even and I don't want to use words like even censor, but how do we moderate it? And so I think that is sort of the dark side of social media, that it really has created space for us to, and I think if you continually are exposed to a thread, a narrative that says, this is not real, this doesn't kill people, this is made up. And personally find it even hard to use those words because I've watched a huge amount of death and I've watched people suffer, but I try to put myself in other people's shoes. If you're exposed to this narrative all the time, then you say, well, that must be true, right? Because it creates another set of reality. And I think is the hardest part about this is I don't know that social media is sort of a genie that we're not going to get back into the bottle. And, the way that we've interacted with this epidemic is not just because of social media, but it certainly, I think, has amplified the ability of alternative voices to come up. And sometimes those alternative voices are good, as I mentioned at the beginning. Like it's allowing us to look at different power structures and people that have been disadvantaged. At the same time, it can be used to sort of subvert, the health of an entire country. I have a feeling we'll be unpacking this for several years, trying to adjust to it. So I think that's the best that I can do.
Well said. And I think you even touched on another question someone else had as far as some of the dark sides of social media and how to manage that. Does anyone else want to add anything to that? Or we can do maybe one last question. We have a couple minutes left. All right, we have one from Lance. How do we educate others of their health misinformation while still being mindful of their personal beliefs, such as people who use their religion to go against vaccination, abortion, and social distancing policy?
I'm going to let someone else take this one. I'll join. It's just tough. It's just hard.
Can you even talk about, sort of the globalization of social media, and Lance also had a question about how do we bridge those, the separation between social work, healthcare providers, kind of creating that connection overall and managing that.
I guess I'll just keep. This is hard, and I think for Ayan and Jasmine and I, we treat patients like we're in front of them. And to a certain extent, our first obligation is always to the patient in front of us, whether she believes in the things that we believe in, whether she sees the world in the way we do, it doesn't really matter. We're there to serve. And so I do think when you're in that one-to-one relationship, it can be a little bit easier. I think we're trained to respect the wishes and the beliefs and the autonomy of our patients. I think where it gets hard is when it moves out of that individual space and it gets into the public discourse, right? And now we're trying to decide for not just, my patient is trying to decide for herself. Now we have a whole county or a whole city or a whole country trying to decide what's right. And that's where, I do think, we come back to certain freedoms that we've put in this country is, freedom of speech as being important. But we've also said you can't yell fire in a crowded theater. And it comes back to that. Again, I'm not a historian, but I think that was an important Supreme Court case, right? So there are some boundaries that we're still wrestling with of trying to figure out what this means. And I think that the cop-out answer, but the true one is it's going to take us a couple of years to unpack. Are we okay? Were we okay with this? Did this work out the way we wanted? And it'll be up to our country to decide if this was, a successful way to attack a pandemic, or including the role of social media, or do we need to rethink that? And we won't decide that today, and we're not going to decide it in January of next year. But it will take us. But we do need to decide. We need to figure that out.
Yeah.
Well said, Jim. Unfortunately, we just have 1 minute left of this. I do need to hand it back to Rick so he can wrap it up. So I know we had a couple questions we couldn't get to, but great discussion, everyone. I'm so glad that we got to answer those. But Rick, I know you had a few closing remarks.
Thank you all, and thank you for taking a stab at Lance's questions. He's getting the award today for the toughest questions and the most as well. So thank you, Lance. And thank you to the panelists. This was great, and for sure exceeded our expectations of what this panel could have been. And like I said, at the beginning of this talk, at the very beginning of every session we've done today, is that when we originally came up with these themes, we didn't even realize how important and how relevant they would be. So I want to just thank you all for your time and for your giving us this hour of your expertise and your experiences. I think we've all learned from it. So thank you. Wanted to, first of all, invite you all to our last session, which is starting at 12:40. We have a 15-minute break, or 10 by the time I actually hang up on you here. Taylor will put in a link for our last session. Our last session is on tools and solutions for managing connection, and that'll be our last one for today, and our last of the Hacking the Human conference for this year. I also wanted to turn it back over to Taylor, and as she gives the 3 door prizes for the attendees who came today. And finally, I want to also one more time thank our sponsors, the City of Phoenix, Audacious Studios, and Nutritional Brands, for your support of our HEALab conference this year. Taylor?
Thanks, Rick, and thank you to our panelists for joining us today, and for all of you attending the event and sticking with us through the end here. Typically, this is an in-person full-day event where we offer giveaways and catered lunch and all kinds of fun stuff like that. And unfortunately, we couldn't do that this year, so we decided we would still support our local food entrepreneurs and offer you all some unique door prizes as part of your attendance here. So we have randomly selected 3 of you to receive some unique prizes. So I'm going to announce those now. The first winner is Bernadette Elliott. Congratulations. You have won a gift certificate for a Nigerian cuisine virtual cooking lesson from Double T Catering. Our second winner is Deborah Hagler. You have won a dozen of ready-to-go sweet glass sugar lids from the Milk Labs. Those are little dessert confectionaries. And then our final winner is Laura Backrack. You have won a snack box of imported goodies from El Salvador from Pupusa Princesses. So congratulations to our 3 winners. We'll be in touch with each of you to figure out our delivery method. But thank you all again for joining us today. And thanks one more time to our panelists for participating in this very interesting discussion. Thank you all, and I hope we'll see you at the next session.
In 13 minutes. See you then. Bye-bye.